So again, I'm Brady Nelson. I'm an assistant professor in the Department of Psychology. I'm here representing multiple faculty in the department who currently have an ongoing collaboration examining the effect of the coronavirus pandemic on the academic, career, mental, psychosocial, and physical functioning of the Stony Brook University community. So there's little need for me to discuss the unprecedented nature of the COVID-19 pandemic, but I do think it's important to acknowledge that it can be viewed as a convergence of multiple overlapping crises. The majority of attention has understandably been paid to the physical health crisis and the need to establish and manufacture reliable and valid COVID-19 tests, treatment options, and an effective vaccine. And to date, there's been a tremendous progress made in each of these areas. There's also been increased attention paid to the economic impact of the pandemic, and it's critical to address the financial needs of individuals and families that have been devastated over the last year. Yet there are consequences of the COVID-19 pandemic that extend far beyond just the physical health and the economy, and that includes the co-occurring mental health crisis. So there are many different ways the COVID-19 pandemic could possibly impact mental health and well-being. It is of course possible that being infected with the coronavirus itself could contribute to central nervous system dysfunction and deteriorating mental health. But it's also possible that the other behavioral and environmental consequences of the pandemic might have catastrophic consequences for mental health, especially since we have all been impacted by the pandemic, but not everyone has actually been infected. So for example, humans are an inherently social species, and we know from extant research that increased social isolation could be problematic for mental health and well-being. Now, in addition, there's been great disparities in how the COVID-19 pandemic has impacted individuals within the United States and around the world. And indeed, evidence has indicated that the COVID-19 pandemic has disproportionately impacted minority populations, notably BIPOC, women, and immigrants. So with a racially, ethnically, and age-diverse sample, this project aims to fill important scientific knowledge gaps and understanding and systematically evaluating the short and long-term academic, career, emotional, psychosocial, and physical changes in an academic system that's representative of academic models nationwide. And our project aims to provide an understanding of how those who may be disproportionately affected by the academic and training disruptions during and post-pandemic, and who are facing potential inequalities. So one of the ways we're attempting to answer a lot of these questions is to do so within our own university community. And this overall project is a longitudinal survey-based study that will attempt to address a number of big unanswered questions. So I'm just going to give you an idea of some of the big unanswered questions that we are attempting to address, but these are not the only types of questions that we're trying to answer. How has the COVID-19 pandemic impacted emotional and physical health? And does this contribute to later academic, cognitive, occupational, or social impairment? To what extent has COVID-19 pandemic undermined access to medical and mental health services? And have access barriers disproportionately affected underrepresented minority Stony Brook University community members? Are there disparities by age, ethnicity, gender, nationality, race, sexual orientation, or social class, and academic, career, and mental health outcomes across university members due to the pandemic? And this includes undergraduates, graduate students, staff, and faculty. And how does social and news sources motivate the use of protective health behaviors? How does interaction with and behavior change motivated by these sources shape memories for COVID-19? And so this project includes multiple investigators across different areas of the Department of Psychology, including myself, Lauren Richmond, Jessica Schleider, Anita London, Dan Klein, and Sherry Levy. Thus far, our initial funding sources have included the OVPR COVID-19 Seed Grant, a National Science Foundation Rapid Grant, as well as a very generous donation for former faculty member Nancy Squires. So I first want to provide a brief overview of the type of information that we've been assessing as part of the survey, which includes constructs of interest to different areas of the Department of Psychology. So again, overall, the project involves a longitudinal design in which we are administering online surveys to the Stony Brook University community. And I'll note that there's definitely room for growth regarding the aims and methods of this ongoing project. And some additions to the projects have been made as the pandemic has continued to evolve. So this has been a particularly unique longitudinal study because there are so many critically changing experiences and moments that we have to kind of adapt as we move forward with additional assessments. So I just want to give a broad overview of what types of information we're including as part of this survey. So we are including very detailed assessments of participant demographics. Our participants are being recruited from the community via emails that we are sending through different sources where anyone at the university is invited to participate. We also created a COVID-19 experiences survey. This was largely influenced by members of the department who had experienced assessing other natural disasters and their impact on mental health and well-being. And so we had to create the survey quite rapidly, and this occurred during the early months of the pandemic in New York, so during March of 2020. And with the creation of this measure, it includes a number of different kind of subscales and domains that can be evaluated. One of the core domains is what we call life changes. And this is really the number of different ways that the pandemic has actually changed everyone's lives across areas like their education, occupation, financial situation, social experiences, and just their overall health. There are also a number of different scales looking at different concerns about the pandemic, including infection concerns, school concerns, home confinement concerns, and basic needs concerns. Now, in addition to these COVID-19 experiences, we also assessed ongoing mental and physical health, including depression, anxiety, PTSD, intolerance of uncertainty, and alcohol and tobacco use. There are also questions assessing mental health treatment history and access, and how the COVID-19 pandemic may impact access to mental health services, as well as additional questions about this topic for parents and caregivers of children who may also be receiving mental health treatment. Questions about memory, including autobiographical and event memory of the COVID-19 pandemic. Questions about cognition, including the need for cognition and news information seeking. And finally, questions about experiences of discrimination, social support, ageism, and finally, academic engagement. And I just want to note at the bottom that the COVID-19 experiences measure that we created, we've actually administered it across other studies and samples, and we've already been able to publish a couple of those studies. So I included citations at the bottom if you had any interest in looking at the types of content that's included with that measure. So the assessment of the Stony Brook University community actually began in March of 2020, so almost a year ago, when the pandemic began to escalate within the New York region. So I just want to walk you through the different assessments that have been completed and that we plan to complete. So the first wave, or the first assessment, was completed between March and April of 2020. We were able to recruit over 2,400 members of the Stony Brook University community. This was a very diverse sample that included approximately 60% undergraduates, but also had graduate students, faculty, and staff. It was approximately 70% women, and had 45% of participants who identified as BIPOC and 25% who identified as sexual gender minority. So at the Wave 1 assessments, they all completed the survey. And roughly a month or 2 months later, we again had everyone complete the survey again. So they were invited to complete the survey a second time. We also continued to keep the survey open to the entire university community in case individuals were not able to complete it during Wave 1. So at Wave 2, between May and June of 2020, we had almost 1,700 individuals complete the survey again. Now, we had a third wave that we completed in October of 2020. And for this wave, we had 517 individuals participate. This was restricted to individuals who had completed either a Wave 1 or a Wave 2 survey. So this allowed us to take all the individuals who had recruited successfully and try and get them to complete at least one follow-up evaluation. And then we will be rolling out at least one more wave, which we will call our fourth wave, in March or April of this year. And we will again open this up to the entire Stony Brook University community. So what will be really unique about this, this project is we will be able to look at university-wide changes based on the samples that we can evaluate between March and April of 2020 and March and April of 2021. But given that we are continuing to contact individuals who initially participated, we will also be able to look at longitudinal analyses within a subset of those individuals. So I just want to provide a little preliminary data from what we were able to collect at the Wave 1 evaluation that occurred in March and April of 2020. So one of the first things we just want to talk about is what were the big concerns that individuals in the Stony Brook University community were reporting at this time. So one of the largest concerns was that someone close to them, to the participant, would get infected with COVID-19, that there would be a loss of social life or social connections, that people would be unable to see or care for sick relatives who are in isolation, particularly among students, that they'd be able to finish the spring semester with passing grades, that there'd be a reduction in family income, and finally, that there would be enough food to eat. So you can see that there are a number of a variety of different concerns that individuals across the Stony Brook community were actually reporting during the early months of the pandemic. Now, regarding some of the mental and physical health variables that we evaluated, what we actually found is that amongst the initial wave 1 sample, nearly 40% of individuals were reporting clinically elevated depression and anxiety symptoms, and nearly 15% were reporting thoughts about hurting themselves. So these are incredibly high rates for what we would expect based on normative epidemiological samples. So even though that this was a cross-sectional evaluation, we can see that these rates are already higher than what we would expect in this type of population. We also found that perceived discrimination was linked to more severe psychopathology symptoms, as well as lower academic engagement, especially within our BIPOC participants. And amongst the participants, nearly 73% of Black participants, 53% of white participants, 55% of Asian participants, and 49% of Latinx participants lost access to prior mental health support because of the COVID-19 pandemic. So even with this wave 1 cross-sectional evaluation of the Stony Brook community, we can already see that there is a profound impact of the pandemic on mental health. One more set of data. So what we also had the unique opportunity to do is, we know that the symptoms of depression and anxiety are elevated. A key question is what's contributing to that? Like what's going on that might lead to higher rates than expected? So what we were able to do is to look at the COVID-19 experiences scales and see whether they were then related to individuals' reported depression, anxiety, and PTSD symptoms. And so each of these columns represents a separate regression in which we looked at the independent relationship between each COVID-19 experience and each of these different psychopathology symptom dimensions. And as you can see, almost every COVID-19 experience was independently related to depression, anxiety, and post-traumatic stress disorder symptoms. Now, what we also did is looked at the independent relationship between these experiences and each of the psychopathology symptom dimensions independent of the other symptoms. So it could be that the symptoms all just co-occur and we're really talking about some higher order dimension of psychopathology. And so what you can see is any of the beta coefficients that are in bold, those represent unique independent relationships between each COVID experience and each psychopathology symptom dimension. And so you can see that life changes is independently relating to all the different forms of psychopathology that we were assessing, and that the different concerns show different patterns of relationships with these different types of symptoms and experiences. So this is just the tip of the iceberg of what we've been able to look at so far. And what I would really like to highlight is that we really do think that an interdisciplinary perspective is needed to really help unpack and ameliorate the pandemic's adverse effects. And so I just want to end by highlighting some of the other ongoing projects and grants within our psychology department that involve the impact of COVID-19 on psychopathology, mental health, and other forms of well-being. And I will stop there. Thank you.